Aricept is used to treat confusion dementia related to Alzheimer's disease. It does not cure Alzheimer's disease, but it may improve memory, awareness, and the ability to function. This medication is an enzyme blockade that works by restoring the balance of natural substances, neurotransmitters in the brain. How to use? Take Aricept exactly as it was prescribed for you. Follow all directions on the prescription label. Don't take this medicine in larger or small amounts or for longer than recommended. You may take Aricept with or without food. Do not crush, chew, or break the regular tablet. Swallow it whole. Usual dose for Alzheimer's disease. Initial dose 5 mg orally once a day in the evening prior to retiring. Mild to moderate Alzheimer's disease. Maintenance dose 10 mg orally once a day after the patient has been on an initial dose of 5 mg once a day for 4 to 6 weeks. Moderate to severe Alzheimer's disease. Maintenance dose 23 mg orally once a day after the patient has been on a dose of 10 mg once a day for at least 3 months. Contraindications. You should not use Aricept if you are allergic to donepezil or certain other drugs. Tell doctor if you are allergic to any medicines. To make sure Aricept is safe for you, tell doctor if you have a heart rhythm disorder, a history of stomach ulcers, an enlarged prostate or urination problems, liver or kidney disease, epilepsy or other seizure disorder, trouble swallowing, asthma, chronic obstructive pulmonary disease, or other brain disorder. Warnings. Before taking Aricept, tell doctor if you have a heart rhythm disorder such as sick sinus syndrome, slow heartbeats, an enlarged prostate, urination problems, asthma, obstructive pulmonary disease, or a seizure disorder such as epilepsy. If you need to have any type of surgery, tell a surgeon ahead of time that you are taking Aricept. Aricept can cause side effects that may impair your thinking or reactions. Be careful of his dry or do anything that requires you to be awake and alert. Aricept side effects. Get emergency medical help if you have signs of an allergic reaction to Aricept, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Stop using Aricept and call doctor at once if you have severe or ongoing vomiting, a lightheaded feeling like you might pass out, slow heartbeats, seizure, convulsions, painful or difficult urination, your voicing and breathing problems, signs of stomach bleeding, severe heartburn or stomach pain, bloody or arterial stools, coughing up blood or vomit that looks like coffee grounds. Common Aricept side effects may include nausea, vomiting, diarrhea, loss of appetite, muscle pain, sleep problems, insomnia, or feeling tired.